Health IQ podcast episode, Breathing Easy in the Fall Air, Respiratory Health.
This month, Joyce and I have been traveling around the county presenting a program to our senior population on respiratory health. As we head into fall and winter, respiratory illnesses increase, and there are some things that we can do to prevent them. Stay with us as Joyce Runyon and I, Brenda Bishop, share what we have learned in our research. Our crew today is Bobby Hockaday, and Joyce is still helping out as crew.
Hannah.
I felt this was a really important topic to get out to our seniors. And then as I was putting this program together, I was thinking we really needed to make it into a podcast too. And after we started presenting, I thought, oh, it is going to be a perfect podcast. Because there are so many things that we could do to prevent these illnesses and enjoy our fall and winter. In Quake County, we've actually already noticed an increase in flu-like illnesses, even beginning back in July.
Oh my goodness. So you wouldn't expect it in July.
So I thought we'd start with a little bit about our respiratory health, and I'll turn that over to you to tell us about that and those first few things that we can do to protect our respiratory health.
All right. So the first thing is that our respiratory system is actually made up of lots of different parts. So that includes your lungs, of course, which we think of, and everything inside your lungs, your trachea, the bronchi and the bronchioles, the little bitty pieces, your diaphragm, which I've never really thought of part of my respiratory system. And when Brenda researched all of this and I got the information and I said, well, what does my diaphragm really do? I know it's there. I know if you do the Heimlich right there, if you need to get something out of your windpipe. But it's an internal muscle, and it separates actually your thoracic cavity, which is going to be your lungs and your heart, from the rest of your internal organs. And so that's actually what helps us to breathe in and out. And all this time I thought it was me and my lungs. But your diaphragm actually controls that. Your voice box is included there, your throat, your nose, your mouth. And all of these are involved with getting oxygen all over our body. So if our respiratory system isn't working, it's going to decrease how much oxygen you're getting in, and that's going to affect if you feel tired, how alert you are, and different things. So your respiratory system is hugely important. And we want to make sure that we are keeping that healthy because we want to be alert. We want to be able to enjoy the fall and all the holidays that come then too, to be with our families. So that's another thing. Sometimes when our respiratory health isn't so good, we may cough. And that's your body's natural response to try to get something out that doesn't belong there. So coughing isn't necessarily a bad thing, but if you're coughing excessively, you probably want to go and see your healthcare provider and see how they can help alleviate that. So some other things that we can do, of course, is not smoking, which includes vaping. Vaping seems to have kind of slid in on the nicotine scene with like a thumbs up, but it's really not good for you. It's a relatively new invention. There's lots of chemicals in all of those vapes. There's liquids in there. In case you hadn't noticed, your lungs really aren't made for liquids. And so it's not a really great thing for you to be taking that in and breathing that into your lungs. And those liquids have a lot more caffeine than even just a pack of cigarettes. So you would have a pack of cigarettes and a vape cartridge would be excessive of a pack of cigarettes. So you may think, well, I just vape, it takes me I do a cartridge in a couple of days, but that's really a lot of caffeine and a lot of other chemicals. Yes, nicotine. I'm thinking I need caffeine. And other chemicals in there that really are not intended for your body. And so that's something you need to remember about. And of course, those can make a lung illness worse, or they can even cause lung illnesses. So it's really important to try to not do those things. And again, if you are someone who smokes or is vaping, you can talk to your healthcare provider, and we can discuss ways that you can lower those and maybe not do them anymore. And then you want to avoid pollutants. So this is secondhand smoke, chemicals, paint, glue, and even radon, which is a radioactive thing, but it's in our soil in New Mexico. So it really is a hazard for us living here. So if you're in any of those situations, you want to make sure that you wear a mask so that you're not breathing those things in, especially if it's a part of your job or if it's a hobby. So we want to make sure you
make sure your buildings or houses are well ventilated to release
you have
that radon.
You're either outside or you're in a well ventilated room, and so that's really important too. And then stay hydrated. We hear that a lot just for our general health, and I've never really tied it to my respiratory system, but it helps keep your mucus thin and clear, and it's easier for you to get that mucus out if you need to do that. As someone who doesn't like getting rid of mucus, it's much better if it's thin instead of thick.
Yes.
And water's the best way to do that. Caffeinated coffee and tea could also be beneficial because there's something in the caffeine that can assist with that. Of course, you don't want to do that excessively either. And always you want to avoid your alcohol and your sugary drinks. So the caffeine has anti-inflammatory properties. And then we want to exercise regularly because our lungs are just something that we do. We breathe automatically and we don't really think about it. You know, like when we go to the gym and I'm like, I'm going to work out my arms or I'm going to build my leg muscles or whatever you're working on. Your lungs really are muscles. And so we have to exercise them as well. And a lot of that to be beneficial is going to be deep breathing. And very few of us breathe deeply. We're very shallow breathers. So some things you can do is practice breathing at home. Inhale, like count to 4, hold it just a little bit. Exhale. You want to make sure that your exhale is probably like about 8 counts. If you can't do that to start with, build up to that. And make sure you do this every day. You can even do it twice a day. When you wake up, that's a great time to breathe. Take some deep breaths when you are at the end of the day. That's another great time just to kind of sit, calm yourself down, take some deep breaths, and exercise your lungs. And when we are exercising the rest of our body, we want to make sure that our lungs are also getting a workout. And so that means that we should actually be breathing hard when we're exercising. And I have to admit, I'm guilty that I don't always like to breathe hard because then if I'm breathing hard, I'm also sweating. But those are really good things for your entire system and especially your lungs because we don't exercise them like we should. Another thing to do is to laugh and to laugh robustly, to enjoy that laugh, to engage your lungs. And I don't know, sometimes when I laugh, I've got an ache on the side and that may be a good sign for my lungs. So we do have a podcast coming up on laughter and it's really going to be a lot of fun. So stay tuned and keep us in mind for that when you see one on laughter coming up. We had a great time. Another thing you need to do is prevent infections. And the top thing you can do for that is always, always, always wash your hands. I mean, we heard that repeatedly during the pandemic. Wash your hands, wash your hands. My hands got chapped because I washed them so often. It's easy, I think we remember when we are making food, wash our hands. After we go to the restroom, wash our hands. Maybe not so much like after we've been outside, touching our pets, doing the chores, wash your hands. Where I'm really guilty of is snacks. I just say, well, I'm just going to eat this snack. And I do, and I don't always wash my hands, but I'm putting something inside of my body with hands that I didn't wash. So that's really another time that people aren't really always, oh, I should wash my hands before I have this couple of nuts or before I have this thing. And so that's just always good to do, just to wash your hands. You don't want to visit people who haven't been well. No. Give them a call, see if you can help them out, maybe drop something off, but you don't want to go and spend time with them. And if you are sick, you should stay home. And if you're afraid or concerned that you might have COVID, then you should test yourself and give yourself peace of mind. And that'll help you know what you need to do to move forward. And always, if you have trouble breathing and you are sick, you want to make sure that you find medical help immediately because you don't want your lungs to be in distress. Because as I said, that affects all of your other body systems.
Or if you're fever becomes above 102.
Yeah, that's really, really bad. And I'm really bad about taking my temperature, but you should do that. If you have a fever, you want to check and make sure where it's at. So,
And starting the end of September, any household can order some free COVID tests from, is it covid.gov? I think is what it is.
it is
COVID test.
covidtest.gov.
Yes.
And you can get 4 free tests per household. And that's just nice to have. It's just a peace of mind for you to have if you would like that. And then the last thing you can do is consider some vaccinations that are specifically targeting respiratory issues. And that includes pneumonia, RSV, which is a relatively newcomer to the vaccine scene, flu, which is a regular annual vaccine that many people take, and COVID, which is an annual vaccine now too.
Yes. So as I was doing research, I found a website that has all of New Mexico's data on it about the illnesses, and it's called the New Mexico. It's from the New Mexico Department of Health. It's called the Viral Respiratory Infection Dashboard. And so I learned there that last year, between November and January, 367 New Mexicans died from pneumonia and or flu. And that's in like today's time, when people should have medications and things, so that monitoring yourself and getting help
Quickly,
when you can't breathe or all, it's so important. I also learned that in July 2024, there was a rise in COVID-19 emergency room visits across the state. So we were already seeing COVID back then. And when they looked at discharge diagnoses for influenza and RSV, Quay County was already rising in the color codes. So they don't really tell you a rate anymore. It's like you have a map, and the darker the color,
the worse you are.
the worse you are. And then from August 25th, 2024 to August 31st, we were pretty medium there in flu activity at discharged from the hospitals.
That seems early.
And I was just like, well, I knew there was something going around. People were telling me they were getting sick, but we were really focusing on the fair and not thinking about that.
Yeah.
But that's a lot of illnesses for that time of year. I also learned that, and I sort of mentioned this, that the surge in New Mexico for influenza type activities and COVID illnesses is from about the end of October, 1st of November, towards the end of January. And so on the charts, they have these little graphs and all, and that's what they tell us. And so I was listening to somebody on a newscast or something, and they said, make sure you get vaccinated before Halloween. Say boo to flu.
That'll be easy to remember.
Yes. So I thought that was a cool little thing to remember. And the other thing that I noticed as we looked at those emergency room diagnoses with COVID from just July and September, those had gone up. But the populations that had gone up was under 5 and over 65. And so
that's we always hear is at risk.
Yes, those are our most at-risk groups. And so then between August 23rd and 29th, there were 1,380 cases of COVID reported in the state of New Mexico.
Wow.
So people didn't always go to the emergency room. They went to their doctor or whatever, and that was reported. So I was like, wow, that's a lot of cases that early in the year.
Yeah.
And of course, we know that around that time, August, the new vaccine for the current types of COVID was authorized and released. So
Well, it was authorized, and I think it'll be here in our county, like October, sometime in October
Yes.
is the tentative date.
The tentative date for for us. So I thought we'd talk a little bit about each of these illnesses. Pneumonia is that infection that inflames the air sacs in our lungs.
Uh-huh.
So it's actually an infection in our lungs that cause them to fill with fluid or pus. And Joyce already mentioned that our lungs aren't made for fluid.
That's right.
They cause a cough with a lot of phlegm or pus, fever, difficulty breathing, and they could be caused by a variety of different organisms.
Oh.
So it could be a bacteria pneumonia, it could be a viral pneumonia, it could be a fungi pneumonia.
Wow.
And I can even remember years ago, my husband had pneumonia, and they called it a dust pneumonia.
That's not good.
But we didn't even realize he had pneumonia. He all of a sudden got vertigo. And when we were at the emergency room, that's what they discovered. It was pneumonia causing the vertigo.
Doesn't pneumonia like crackle? Don't you hear a sound with it? Or
But when you have that walking pneumonia or dust pneumonia, it doesn't crackle like that.
that's interesting.
Yes. So, but often there is a crackle. But often we'll have a fever because it's an infection. You have shortness of breath. You may be panting trying to get breath.
Yes. Because your lungs have all that bad stuff in it.
Yes.
That shouldn't be there.
You, of course, have a horrible cough. And I recently had a friend who was a pneumonia that was causing her cough. It had such a bad cough that she pulled muscles in her back.
Oh, no.
So, it could lead to other things. So, all the reason to have that. So, the guidelines for vaccines have changed. So, years ago when I got my pneumonia vaccine, my doctor said, well, since you're below this age, you'll need to get one again when you're, I think it was 65 or something. But now the guidelines have changed. And if you've had an older vaccine, they've come up with a new one. And they would like everybody who's 65 and older to get one of the new vaccines. And they have one that is a 2-shot or one that's a 1-shot. And that sort of depends on, I think, where you're located or what's available.
Okay.
But either of those, but they would like everybody 65 to get that. And it's a one-time thing after you get
This new vaccine.
You're not going to have to be expected to have it all the time. But if you get the one that's the 2-shot, you get it them a year apart.
Oh, okay. Do they recommend anybody under the age of 65 to get that, or would it just depend on your health risks?
I think it would depend on your health risks, but if you are health risks for other things, and they would then
Like get chronic issues or
chronic issues, or overweight and those kinds of things, they would you might consider getting that. And all those things you need to visit with your healthcare provider about that pneumonia shot. But I felt at the time there was a lot of pneumonia going around here, and I thought, well,
I don't have time for that.
this vaccine's been here a long time. I'm a really busy person. I better get that. And I actually have known people who've died from pneumonia because it is so hard on them. In the United States, about 41,000 people die each year.
Wow.
From pneumonia. So another one is the RSV, and that's sort of a new vaccine. It came out last year. And the CDC recommends that all adults 75 and older get the RSV vaccine. And it's also recommended that those between 60 and 74 get that. But you could check especially if you are at increased risk.
Okay.
If you have and then we do have the most group that's at most at risk, of course, is our young children. And so that's part of their routine vaccines now, is to get that. RSV is a common respiratory virus that affects the lungs, but can also affect the nose and throat. It spreads in the fall along with other respiratory illnesses. It usually peaks in January. And so we've all known kids that have had that horrible croupy cough, had to be tented and all kinds of stuff to try to get rid of these symptoms. But for us older adults, it's more of a stuffy runny nose, a mild headache, mild cough, fever, sore throat. Sound familiar?
All your respiratory system.
Yes, just like many of the others. But then it can move into that difficulty breathing, the rapid breathing, the wheezing, and severe cough.
So is the RSV an annual shot?
At this point, it's a one-time shot.
Okay.
Now, it's a new shot, so they
may change as it goes along.
May say later that we need to add a second shot, say 5 years or something.
A little booster.
A booster. So it is estimated that hospitalizations for older adults for RSV is 60,000 to 160,000 a year.
Wow.
And we lose 6,000 to 10,000 older adults to RSV in the United States. In Quay County, we are fortunate enough that our pharmacy can give this RSV shot, so you don't have to leave town to get this shot. And you just make an appointment, and I think you were talking with them the other day.
Yeah, so you just call them directly. A lot of the other shots that we get from the pharmacist, they has to be prescribed by your healthcare provider, but you can just call them directly, and they will set you up an appointment. They'll talk to you about your insurance, because there could be co-pays associated with that. And then you just go in, they give you your shot. If you have to, some of the, not RSV, but some of them, there's more than one dose, and then you'd go back for the other one. And then they update your vaccine record, and then they notify your healthcare provider. So you don't have to remember, oh yeah, I went in 3 months ago, because, not all of us see our provider like every day. So it's just nice that they take care of that for you too, and keeps everybody on track.
And they are not requiring a doctor's prescription for RSV, right?
No, you just call the pharmacy, and they'll take care of everything for you.
And I did forget to mention, if you want a pneumonia shot, almost every healthcare provider here in the community, all the clinics has that available and can give it to you when you're there for your regular appointment.
Yes. And if you don't have a regular appointment, they would make one for you to get these if you would like to have them.
So we're all pretty familiar with the flu, and a lot of us say, oh, I don't want to get that vaccine because it didn't work last year. But the flu involves being tired, a headache, general aches, pain, sore throat. Often it doesn't last as long. But one of the things about the flu is that it can migrate into pneumonia or something else. So that's one of our things that we need to think about. And so each year, the scientists try to figure out what is the most prevalent influenza viruses going around, because they mutate and change and all that. And they make each year's shot with what they think is going to...
What you might get.
But even if you still get ill from a flu-type illness, that your chances of being hospitalized are less if you have had the vaccine, because you still have some of the general antibodies.
Well, it should reduce the severity.
Right.
So.
And hopefully you get over it faster.
Yeah.
So it's recommended that everyone 6 months and over get this vaccine. It's every year, and you should, as I said, have it before Halloween. And they are formulating the vaccine differently now. So a lot of people have thought in the past they couldn't get it because of egg allergies.
Oh, okay.
And that was true, but now they're making it a little different. So even if you have egg allergies, you should still be able to get it. And some people can, depending where you live and all, can even get it as a mist sprayed in their nose.
That's right. I have heard that. For those people who are against needles.
Yes, or children.
Yes.
So there is also a high dose of vaccine that's recommended for people over 65.
Okay.
So if you're here in Quay County and you are over 65, the Presbyterian Medical Services Clinic called Quay County Family Health on Main Street will be getting the high dose soon.
Will they be the only ones, do you know?
Last year they were the only ones with the high dose.
That's just good information to know.
Yes. But all other clinics are able to provide you a flu vaccine. And we have many special clinics around the county being put on by different groups that can help you get that flu vaccine. And even with that, our flu vaccine, and I should have looked that number up, our flu vaccine rates for last year was only about 50%. And we still have in the United States over 25,000 people who die each year from flu.
Well, I think some of that could just be related to that people are staying home more and they don't feel it as at risk. And so they may not say, well, I don't really feel like I need that. But that, that's always something you need to talk to your provider about. And all of these clinics, they're like we've got some in Logan, we've got some at San Juan, at House. They're even like a drive-through where you can just go in your vehicle and they'll take care of you. So they try to make it as easy as possible for you to get these.
So we're still waiting on dates for all those clinics because they're waiting on the vaccine to come in. So please follow our social media. And as soon as we have dates, we will advertise those. But we do know that there will be a drive-through clinic in Logan on October 19th from 8 to 11 at the PMG clinic, and in Tuncumcari from 8 to 11 in the convention center parking lot. And they really do a cool thing. You just drive up, you hand them I think it's your driver's license, they fill out the paper, you sign some paperwork, and you drive to the next station and they give you a shot. It takes like 5 minutes.
Yeah.
So
really super easy.
But also, if you're in other larger counties, the pharmacies will offer flu vaccines as well.
The chain store pharmacies.
The chain store pharmacies, yes. Not our pharmacy, but they are doing RSV.
And flu is going to start being one of the vaccinations they offer. They just don't have it yet.
Oh, so that's cool.
Yeah.
So another bit of information. So that brings us to COVID-19. And now, as just like flu, the COVID-19 strain changes. It mutates. The variant changes. So they make a new vaccine, and they're going to start probably doing this yearly. So we have what they're calling the 24-25 vaccine that was just authorized that is targeted at the recent variant. It also still has some of the other, so it will, if you don't get the recent variant, you get a previous variant, you will be covered as well. So this will be available soon, and it will be available in Quay County at our public health office. That's the only place in Quay County. If you go to a larger community, to a chain pharmacy, that's where you would need to get the flu vaccine. It is covered by most, or the COVID vaccine is covered by most insurances.
And I think the public health office will also provide this to anyone regardless of their insurance status. So
correct.
Sometimes they specialize more with people who are underinsured or not insured, but this shot is available to anybody in the community. You need to call and talk to them. Make sure they have the 2024-2025 version, because that's the most recent one, and that will be out hopefully in October, available around here.
Right. And so anybody 6 months and older is recommended to get this vaccine. It will help prevent severe illness, hospitalizations, and possibly death. And there are a few things. If you must wait at least 2 months if you recently really received a previous vaccine. I know when my mother went to her physician, he told her that her age groups, they're going to start giving her a vaccine every 4 months,
Wow.
a COVID vaccine. So I thought that was unusual. If you have had COVID recently, you must wait 3 months to get the vaccine. And we do know that the group over age 65 is one of the groups that's most disproportionately impacted by COVID. And so that's another thing just to think about as you think about, do I need this vaccine or not? It's always important to talk with your healthcare providers.
Yes.
And we have mentioned if you're at risk a lot. So those people who are at risk are those who are over 64, those who have medical conditions like asthma, heart disease, diabetes, HIV, cancer, and kidney disease, pregnant women, young children, and minority groups, and people with disabilities, because often they're just not receiving the other care.
Yeah.
So as we were presenting this, you said to me the other day that other health councils don't do programs like we do.
Don't.
And I said, well, and you said, well, they probably don't have the capacity. And I said, oh, they don't. And maybe they have other options as well, with being able to bring resource people in. But being remote rural, we don't often have resource people who can come.
They're 2 hours away.
and present a program at a time when what's convenient
need it. Yeah.
for our population. So we have sort of committed to researching and doing some programs of our own, and this is one. And you and Rochelle have been doing several others. You want to talk about those?
So Rochelle actually developed one on safe medication, and we've shown that to all of our senior centers. And that's just a good reminder of how to make sure you're taking your medicine safely, that you're disposing of it properly. We're going to have one on laughter coming up that we've developed. We're going to have one on stress. We've done a lot, and some are in production as we speak. We also get certified by other organizations to do these presentations, and that would include a Youth Connections program, which is a youth resiliency substance misuse program for young adults. We've done Narcan, which is something we do exclusively pretty much in our county, and we've trained almost 400 people on that. We've gone to all of our schools, and we had to get certified for that, and maybe you have to look at recertification here again pretty soon. And then another one we do is QPR, and that's Question, Persuade, Refer, and that's a suicide prevention program. And that's something Rochelle and I are trained in and certified in to go out and do. And so we offer a lot as the Health Council. I don't think people realize that it's not just about committees and doing activities and events, but we really try to meet the needs that we see in our community. And we spend time to do that and research to make sure that we're presenting the best information we can.
Yes.
So
if you have a group in need of a presentation of one of these, please email us at healthiqpodcast@gmail.com, and we'll get back to you.
Yep.
Of course, we don't travel too far outside of Quake County, but so we end with food for thought, and we don't have much time, but here's my food for thought for today. The ability to breathe is a gift. Wake up grateful each day for that gift. And that's from Brent Reeder. And I was just thinking, we should be just so thankful for all the things that how our body works to start
amazing.
with.
It's an amazing system.
And do what we can to keep our lungs and our breathing and everything going.
Well, and we take breathing for granted. We don't think about it. We don't think about our lungs. We don't think, am I breathing deeply enough? Am I getting oxygen everywhere it needs to be? And so it really is a gift. And it's an amazing thing that helps all of your systems. If you don't have that oxygen, you're in some serious trouble. So let's take care of our lungs.
So, thank you all for joining us today as we covered an important topic that may save your life or keep you out of the hospital. Join us next time as we cover another important topic for your health.
Our hosts for this episode were Brenda Bishop, Quay County Health Council Coordinator, and Joyce Runyon, Assistant QCHC Coordinator. Special thanks to our locations manager, Gordon Runyon, for helping keeping us cool. The Health IQ crew. Director is Robert F. Hockaday. Producers video audio are Robert F. Hockaday and Joyce Runyon. Second AC was Joyce Runyon. Editors are Joyce Runyon and Robert F. Hockaday. Funding for Health IQ provided by a New Mexico Better Together grant. Brought to you by the Quay County Health Council. Follow us on YouTube, Facebook, and Instagram at Quay County Health. If you have any content ideas, reach out to us by email healthhiqpodcast@gmail.com. More info about this topic and more available on our Health IQ blog, qchealthhcouncil.org.
This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.